Hello everyone. So today I'm going to tell you all about the case study on bipolar affective disorder. Okay. So first, as you all know, that you all have to write the demographic data of the patient, that is their name, age, sex, whether they are married or not, then religion, education, occupation, then the address when they were admitted to the hospital, then the IP number which will be there on their papers, then the ward they are admitted in, then the diagnosis, informant, and information. So you'll have to write who is the informant, okay, from where you got the information, and whether you think that the information is relevant or irrelevant or partially relevant. Okay, next is the present illness. Okay, so in this you'll have to mention the chief complaints on admission. So when they were admitted, what were the complaints? So first you'll have to write according to patient what was the complaint, and then according to informant why she was brought to the hospital, that has to be mentioned. Okay, then comes the history of present illness. So you'll have to mention now what she is suffering from. Okay, then comes the history of current illness. So here you have to write what she is suffering from now. Now what she has now. And in history of present illness, you all have to mention that now which problem, whatever problem she is having. Okay, what was history of that problem? Like what was the duration of that problem? Okay, so you have mentioned here what was the duration of that problem which had occurred. Then what were the predisposing factors? What was the mode of onset? Okay, everything you'll have to mention. Then comes the past illness. In that you'll have to mention past medical history, then the past surgical history, and past psychiatric history, whether she had same episodes before. Okay, and that time what was the diagnosis made and what was the treatment given. Then comes the life cycle. Now in life cycle you'll have to mention from when this disease condition started. Okay, and that time what were the symptoms. Okay, so see here I have mentioned what were the symptoms. Okay, so I'll have to mention in the same way. Then comes the family history and family description. Then the genogram you all have to draw from the maternal side also and paternal side, so both will come. Okay, then comes the personal history, like the perinatal history, the childhood history, educational history, play history, occupational history, then the habits. Then comes the physical examination. Now in mental health nursing, no need to give much focus on the physical examination. Okay, so this is all physical examination, so you all can go through this. Okay, then comes what treatment the patient is on. So you'll have to mention all the medication, their dose, what is the frequency, and what are the actions. Okay, then comes the investigation. So this investigation you all will get on the patient's case paper. Now in mental health nursing, it is very important to focus on mental status examination. Okay, so here you'll have to mention the same identification data that previously that was mentioned. Then comes the general appearance. Okay, then you all have to write the speech, how their speech is. Okay, spontaneous, then what is the reaction time, how the tone is, how the stream is. Okay, then you'll have to write mood and affect. So in here you'll have to ask questions. Okay, and according to that you'll have to write the inferences. Okay, so this is mood and affect. That comes thought. Okay, so in thought you'll have to write thought insertion, thought removal, thought withdrawal, and whether they are having too many thoughts in their mind or not. So racy thoughts. So you see the same question whichever I have mentioned here, no, that only you all have to ask. Okay, so you all can go through this very nicely. I've written the same thing you can ask to the patient. Then comes content. So you'll have to write delusion of control, then the persecution, grandiosity, somatization. Okay, this everything the same questions you'll have to write. Then comes perception, like whether they are having illusions or whether they are having hallucinations, like visual hallucination, auditory hallucination, olfactory hallucination, gustatory hallucination, tactile hallucinations. Okay, so everything will come in the same way. Okay, then comes cognitive functions, Then whether their orientation, you'll have to mention like whether they are oriented to the time, place, person. Okay, you'll have to see how their attention is. Now here you all can ask them to repeat the digits or also alphabets. Okay, then you'll have to see the concentration, so you'll have to tell them to subtract some numbers. Okay, according to that you'll have to write. Then you'll have to see their memory, so in that it will come immediate memory, recent memory, and remote memory. Okay, so see, I have mentioned your questions. Okay, the same thing you all can ask. Then comes intelligence, abstraction, then their personal judgment, the social judgment, the test judgment. You'll have to ask questions like, if the house catches fire, what will you do? Or if you see a snake in front of you, what will you do? You see a tiger in front of you, what will you do? Such questions you will ask. Okay, and according to that, inferences should be made. Then you all have to write insight. Okay, so you all have to see whether it is 1, 2, 3, 4, 5. Okay, whether the patient is partially aware about his condition, there is complete denial of illness. Okay, so according to that you all have to write the insight. So these questions only you'll have to ask. Okay, which I have mentioned. Okay, then comes the summary. So see, here my patient was on grade 2, means he had slight awareness of being sick and deny at the same time. He knows that he is sick, but also she denies it. Then come comparison with book picture. So you'll have to compare the patient symptoms, like patient whatever she is having, with the book picture, whatever is given in the book. So I mentioned here, one can go through this. Then comes the nursing process. You'll have to identify the problems, and according to that, diagnosis should be framed according to the priority. Okay, so see, very nicely I have written. You can copy this or go through this. Okay, see. Then comes the nursing care plans. So everything I have mentioned in the same way you all have to write. So 3 nursing care plans you all have to explain. Okay. Then comes the health education. So you'll have to give health education to the family. Okay, so you all can tell them about lifestyle, medication, exercises, rest and sleep, hygiene, and follow up. Then comes the progress note. So 3 days progress note you all have to mention whether the condition was improved, deteriorating. Okay, what you all have observed, everything will come. Then comes the bibliography. So I have given the bibliography. Okay, you all can write this in the same way. Okay, this is the correct way to write bibliography. So it is Srivani, K.V. Tripathi, and Mary C. Townsend. Okay, thank you.